We talked about different types of treatments ranging from creatine to omega-3 fatty acid supplementation, some herbal and indeed some essential oil treatments, as well as acupuncture, all of which have been shown to have significant impact in reducing the frequency and intensity of headaches.
Welcome to Everything Kayla, your ultimate channel to transform your mind, body, and soul. Don't forget to click the like and subscribe button.
And in many cases, reductions in the frequency and intensity of headaches that are at least as great as the results that are seen with non-steroid anti-inflammatory drugs. Again, I want to highlight that none of these approaches are necessarily designed to be done on their own or in replacement of prescription drugs from your physician. There are excellent prescription drugs out there that your physician can prescribe for you for the treatment of headache. Nonetheless, I think many people are interested in the things that they can do in order to inoculate themselves or at least reduce the likelihood of experiencing headache, especially for people who are experiencing chronic recurring headaches, such as migraine or the other forms of headache, which can be so debilitating. We are going to have different types of headaches and different approaches to treating headache. But if you keep in the back of your mind that you have neurons that contract muscles to create movement or tension of muscles, remember you can turn off those neurons and allow those muscles to relax. You have sensory neurons that sense input and actually sense the pain. And you have modulatory neurons, which can allow you to adjust the relationship between the sensory neurons and the motor neurons. And of course, some of you are probably screaming at me by now saying, wait, why would you ever want to deal with the motor neurons or the modulatory neurons? Wouldn't you want to just go straight to the source and just cut off the pain? Well, the problem there is that many painkillers have other issues as well. In particular, they can be sedative. Many of them can be habit forming or even addictive. And for many people, not all, but many people, they don't want to take drugs, whether or not they're over-the-counter or prescription drugs or even more natural supplement-based type treatments. And they would rather use, for instance, a behavioral approach in which they can modulate, they can deliberately turn off the communication between sensory neurons and motor neurons. And it turns out those approaches exist as well. Instead, what I'd like to do next is talk about the different types of headaches. And I think this is something that's very important and not often discussed, except for those people out there that unfortunately suffer repeatedly from certain kinds of headaches like migraine or cluster or tension headache. But I think for most people out there who experience headache, and again, that is everybody at some point experiences headache, rather than just think of headache as one thing, understanding the major types of headache and how they differ from and are similar to one another will really help you identify what the best source of treatments for those are. Tension type headaches tend to start off, not always, but tend to start off as more or less a halo or a headband around the forehead and the area above the eyes, often also include the jaw, the neck muscles, and can extend even into the upper back. Again, this can be caused by some low level of infection, but more often than not, tension type headaches are going to come on because of some chronic psychological stress, usually combined with lack of sleep, usually combined with lifestyle issues. The other type of headache that unfortunately is very common is migraine headaches. Migraine headaches are defined generally as disorders of recurring attacks of headaches. So people who get migraines often get them in a recurring fashion. Some people get them very often, other people get them less often, but migraines are very debilitating. The numbers, that is the prevalence of migraine, is still pretty debated. One thing that we know for sure is that females suffer from migraine headaches at a rate at least threefold higher than do males. And surprisingly, this does not seem to have any direct hormonal origin. The next type of headache is cluster headaches. Cluster headaches are the ones I mentioned earlier that arise from deep within the head. They feel as if they're coming from the inside out, and they tend to be on one side or the other, what scientists and clinicians call unilateral. It tends to originate behind the eye and sometimes the nose region, sometimes in the mouth region as well. It feels kind of patchy, but as if it's coming from the inside out. And again, perhaps cluster type headaches. So the first substance that I'd like to highlight that has been shown to significantly reduce the intensity and or frequency of headaches is creatine. Now, creatine, as many of you know, is something that people supplement and take. Most often, creatine is discussed in the context of muscle performance, not just for people who weightlift, but for people who do endurance exercise. And it's often been said that 5 to 10 grams per day of creatine monohydrate, depending on how much you weigh, 5 to 10 grams per day of creatine monohydrate can increase creatine phosphate stores in muscles, can bring more water into muscles, can make you stronger, can increase power output, and that is all true. Supplementing with omega-3 fatty acids to a point where you're getting above 1 gram per day of EPA is not just going to be beneficial for treating and reducing the frequency and intensity of one particular type of headache, but many types of headaches. And when you combine hormonal headaches, tension headaches, and migraine headaches, you account for more than 70% of the total types of headaches that are out there. An emerging idea in the realm of headache treatment is the idea that if you can offset some of the early signs, you can offset some of that photophobia and aura, perhaps through the use of dim red lights or red lights, as I've described a moment ago, then you might be able to reduce the probability that you're going to have a migraine or other type of headache entirely. So again, no need for expensive red lights, but you can find red lights very easily online and simply have them on hand or replace the current lights that you have on your nightstand or in whatever room you happen to be in. Tension headaches are often associated with tension of the muscles that are on the skull, of the jaw, of the neck, and can be quite painful for many people and debilitating. And the most common treatment for this that most people rely on, that is to take non-steroid anti-inflammatories. So things like acetaminophen, ibuprofen, sometimes aspirin and things of that sort. And oftentimes those can be helpful. There are a couple things to keep in mind, however. The NSAIDs, non-steroid anti-inflammatory drugs, oftentimes will work very well at first, but people quickly develop a tolerance to them, meaning they're going to have to take more and more in order to get the same effect. And oftentimes they can't take more and more because some of them are very hard on the liver. And in addition to that, some of them can offset some other things that you really want. So for instance, it's now known that non-steroid anti-inflammatory drugs can offset some of the benefits of exercise. And that makes sense because a lot of the adaptive benefits of exercise actually come from experiencing a lot of inflammation acutely. That means you actually want inflammation during your resistance training workout or even your endurance workout. But then that inflammation triggers an adaptation event or series of adaptation events that leads to greater strength, greater speed, more muscle, more endurance, whatever it is that you happen to be training for. So reducing pain can be good, of course, but not if you have to take more and more of a given drug that it has side effects on the liver and can offset the effects of exercise and so forth. The other issue with non-steroid anti-inflammatory drugs is that many of them simply do not work for many people. Or again, they'll work the first time and the second time, but then they stop working. They also tend to lower body temperature. I think most people are aware of this because many of these same drugs are used in order to reduce fever. But if you are taking non-steroid anti-inflammatory drugs simply to reduce your headache and you're lowering core body temperature, that can have all sorts of downstream issues related to sleep-wake cycles, to metabolism, to immune system function more generally, and on and on. If Botox is injected into the muscles themselves, it can provide long-lasting relief of certain types of headaches, in particular tension-type headaches. So while it seems like a bit of an extreme treatment, people who suffer very badly from tension-type headaches due to hypercontraction of the muscles of the forehead or around the temples or around the jaws or certain parts of the neck and the muscles of the neck that encroach on the back of the skull, or that actually connect to the back of the skull, can achieve tremendous long-lasting relief from these Botox injections, sometimes for weeks or months or even longer. People go in for periodic re-ups of Botox. It actually is quite safe, despite the fact that botulinum neurotoxin is quite dangerous. It's given in very low doses and given locally, so those are the only muscles affected. So essential oils applied to the skin can reduce the symptoms of tension headache in a significant way and actually can lead to some offset of some of the cognitive defects seen with headaches. So that's itself very impressive, I must say. It was surprising for me. It kind of put me in my place as somebody who thought, oh, essential oils is going to be like, okay. But it actually seemed to really hold some merit. And when you compare the magnitude of the effect, even though this was an enormous number of subjects, you compare the magnitude of the effect in a paper like this or similar papers on these essential oils to the impact of non-steroid anti-inflammatory drugs, and they really hold their own and in some cases exceed the positive impact of anti-inflammatory drugs. So for that reason, I think we can look at peppermint oils and peppermint and eucalyptus containing oils, menthol containing oils applied to the skin for the treatment of tension type headache as among the more potent treatments available out there. In the same way, acupuncture, which of course has existed for thousands of years, has been used very successfully to treat headache and other forms of pain, so much so that many insurance companies will now pay for acupuncture as an insured practice. Not all, but many will. And people in the West are starting to adopt the understanding that acupuncture, yes, indeed, it really does work for relieving pain. And laboratories, both in the United States, such as Chufu's and elsewhere are starting to find the underlying mechanisms. And those mechanisms include deactivation of the pain pathways, activation of some of the parallel pathways that assist in shutting down pain or in relaxing the muscles that are causing tension type headache, as well as activation of neural pathways that impinge on organs that then cause or reduce the release of molecules into the body that give us the experience of pain. So reduced inflammation and in many cases, increasing anti-inflammatory pathways. But the goal is always, I believe, or I should hope, for people to find ways that they can control their health outcomes and reduce things like headache using a minimum number of things that have other side effects. And that, of course, can also include the use of essential oils in conjunction with things like non-steroid anti-inflammatory drugs, or the use of red light to offset photophobia in conjunction with any number of different treatments, either prescription or otherwise. So I do want to make that clear. If you are somebody who ingests caffeine every day and you do not ingest caffeine, you will indeed get a headache, and drinking caffeine will relieve that particular headache. Some people, when they drink caffeine, it really improves their headache. It's in some cases very significant effects. Whereas other people, when they drink caffeine, it really exacerbates their headache. Curcumin has been shown to be effective as an anti-inflammatory and has been shown to be very effective in treating different types of headache, in particular migraine headache. Curcumin, when taken at dosages of about 80 milligrams, although for those of you very sensitive to curcumin, probably as low as 25 or even 50 milligrams per day, in conjunction with, although not necessarily at the same time, but taken daily alongside omega-3 fatty acids at 2.5 grams per day, led to significant improvements in migraine and other forms of headache, meaning both the frequency and the intensity of the headaches that occurred was greatly reduced.